Minister, have you had any updates on the situation overnight?
Yes, so in the 5 a.m. update this morning, we have a total of 68 cases in the Avalon cluster. We've had 28,000 tests on the last reported daily update, and we know that, for example, the Commonwealth testing clinics have seen a 700% daily increase. So the people of the Northern Beaches and of Greater Sydney are responding magnificently. I want to thank them and acknowledging their work for those in the Northern Beaches. They are getting tested, but other than that, they're overwhelmingly staying home. They're going through a difficult lockdown, but we've done this before. In a world of 700,000 cases a day, we've had 71 cases in the community across Australia over the last 7 days. So it's challenging, but we can do this, and we know how to flatten that curve, and all the things that are necessary are occurring. Testing, tracing, and distancing. So difficult, but we'll get there.
There has been calls for more testing locations to try and reduce the wait times and reduce the crowds that we are seeing. Is that something that the federal government is looking to assist with?
So we have expanded our testing roles. We have, as I say, a 700% increase in terms of testing within our Northern Beaches area. At the same time, New South Wales has established pop-up clinics, and they've also created triaging, which means that they're giving priority to those that have symptoms or are contacts of known cases. What we've seen around Australia, whether it's been in Shepparton or South Australia, whether it's now on the Northern Beaches, particularly around the Avalon cluster, the community responds, and that's what has protected Australians. So they're doing the right thing, and in New South Wales we have not just, I think, Australian gold standard, but global gold standard contact tracing. So they're the disease detectives that go upstream to look for the source of an outbreak and downstream to look for any possible further spread. And with the partnership that's in place with the community, where they're staying at home or otherwise coming out simply to be tested, that's the Australian public knowing how to respond. And I think the rest of the world looks at what Australia's done, and they look on in awe. But I think perhaps the most important thing is that sense of community spirit and responsibility.
Absolutely. Minister, should there be an emergency National Cabinet meeting on the matter as flagged by Anastasia Palaszczuk yesterday?
Well, the medical expert panel has been meeting daily, and so they are meeting daily. That triggered the Commonwealth hotspot definition, which was announced by the Chief Medical Officer of Australia, Professor Paul Kelly, and that led to the responses by the states which were pre-planned, pre-prepared, and which have followed that hotspot definition. So there's daily engagement between the Commonwealth and all of the states through the medical expert panel, and we continue to work with colleagues. We continue to provide Commonwealth support. For example, the Australian Defence Force, 1,500 Defence Force around the country, an extra 50 being provided to Victoria, 350 in Queensland, 380 in New South Wales, and the additional contingent will take it to 285 now in Victoria. So right now, that engagement could not be deeper, closer, or more thorough.
Minister, just finally, what do you make of the commentary from other states on New South Wales' response to the outbreak?
I will say that from our perspective, what we're seeing is an outstanding, clear, rapid response following those three elements of testing, tracing, and social distancing. We know the steps. They have acted immediately. They've kicked into action the extra layer of each of those three, and with testing rates as high as that, then that's an immensely important step. But the last thing I'd say is Many people will now not be able to see each other in person for Christmas. For isolated older Australians, that can be very hard. So please be aware of the emotional and mental health support, both the formal channels, the Head to Health channel or Beyond Blue, the coronavirus hotline, but the social channels of calling each other, of texting each other, of FaceTiming, of being in contact. This is the moment to think, is there somebody who's isolated? Can I help them and can I support them? We're going to get through this, but the more support we provide to each other, the stronger the outcomes will be, both in terms of health, but also in terms of mental health.